Knowing whether we have a silent hepatitis C viral infection is particularly important for us women, because we can unintentionally pass this dangerous virus on to loved ones or to our newborn child. Certain lifestyle or life history events put women at greater risk for contracting hepatitis C infection. In my case, I was at increased risk because I worked in a research lab studying hepatitis C for several years. I received an annual test to screen for the virus in my blood and, fortunately, my tests always came back negative. Women born after 1976 have a very low risk of hepatitis C infection, less than approximately 5 out of 1,000, says Camilla S. Graham, MD, MPH, for the Division of Infectious Disease at Beth Israel Deaconess Medical Center in Boston, and assistant professor at Harvard Medical School. Dr. Graham is an expert in hepatitis C and the special risks faced by women and children. About 60% of new cases of hepatitis C are from injection drug use, and about 20% are from sexual transmission. Graham says. The Centers for Disease Control and Prevention, CDC, reports that about 2.7 million Americans have a chronic hepatitis C infection. About half of those infected are women, but most don't know they have hepatitis C. Yet even without symptoms, they can still spread the infection to others. Hepatitis means liver inflammation, and hepatitis C is liver inflammation caused by the hepatitis C virus, also called HCV. This virus enters the body through exposure to the blood of an infected person. It is the most common blood-borne disease in the United States today, and causes more deaths each year than either hepatitis B or HIV. What puts women at risk of hepatitis C infection? Here is a complete list of risk factors for hepatitis C infection, shared by Graham. It combines risk factors stated by the CDC and the U.S. Preventive Services Task Force. Each of the following factors put you at higher risk than the general population for hepatitis C infection. A birth date between 1945 and 1965, past or present injection drug use or intranasal drug use, sex with an intravenous drug user or high-risk sexual behavior, blood transfusion, organ transplantation or surgery prior to 1992, hemophilia, long-term hemodialysis, EVE infection, elevated liver enzymes, alanine aminotransferase, ALT levels, having been born to a hepatitis C-infected mother, incarceration, prison or jail, long-term daily alcohol use at high level, shaving, gotten a tattoo in an unregulated environment, exposure to blood from needles or sharp objects. How can we protect newborns from hepatitis C? The CDC reports that for every 100 infants who are born to hepatitis C infected women, 4 of the babies become infected with the virus. Pregnant women who have any risk factors for hepatitis C virus infection should speak to their doctor about having a screening test for the virus, Graham says. In some obstetric practices it may be best to test every woman, she believes, because it's hard to know which risks apply to an individual patient. 4 of 100 is a 4% risk of transmission to the baby, and this risk goes up by 10% if a woman also has HIV, explains Graham. An estimated 23,000 to 46,000 children in the United States have hepatitis C infection, she notes. The danger of infection comes from contact with small amounts of blood during childbirth. The risk for transmitting the viral infection to a newborn is not the same for every mother who has hepatitis C, and Graham says this area is controversial. High HCV viral load may increase the risk. Women with HIV tend to have higher hepatitis C viral loads, which may partly explain the increased transmission risk with HIV co-infection, she says. The risk of transmission increases to about 15% for women with both hepatitis C and HIV. Mothers who have had chronic hepatitis C but no detectable virus in their blood cannot infect their newborn child. Related, are you at risk for hepatitis C? If a woman is hepatitis C antibody positive but there is no virus in her blood and she is hepatitis C RNA or viral load negative, she was exposed in the past but spontaneously cleared the infection, says Graham. In this case, the woman does not have an active infection and cannot pass hepatitis C virus to anyone, including a baby. She could get infected in the future and not clear the infection, so she needs to avoid re-exposure, Graham adds. Of every 100 infants born to hepatitis C infected women, 4 babies get the virus. The mother's condition certainly matters in infection risk, but how the fetus is monitored during labor is also important. Fetal scalp monitors have been implicated, as have prolonged rupture of membranes, over 6 hours. Graham says. But a doctor can take certain steps to protect a baby from infection during birth. Graham explains that if doctors know a woman has hepatitis C virus, they should avoid using scalp monitors on the baby that could cause bleeding. There is no evidence that cesarean section reduces the risk of transmission of hepatitis C virus, she adds. Testing a baby born to a woman infected with hepatitis C virus should happen at 18 months of age. Up to 40% of children with hepatitis C will clear the virus spontaneously without treatment, while others may need medical treatment, but not until age 3. What are the pregnancy risks of hepatitis C treatment? If a woman who is pregnant is tested for hepatitis C and found to be positive, carrying the virus, medical treatment cannot begin during pregnancy. This is because certain hepatitis C medications are a risk to the fetus. Treatments for